This is Because Teeth Podcast with Greg Santiago and Cody Preble. All right, Because Teeth Podcast episode.
Oh, yeah.
Episode O, you already know. And today is just going to be kind of a filler episode. It's going to just cover what we've been going through, what we've seen, what we're done, what we got in the future, everything like that. So without further ado, let's just go right into it.
Yeah, we've been through a bit in the past couple of weeks here.
Yeah, so we've been kind of gone, I guess, a little bit from the podcast. We haven't been recording so many episodes just because we got a lot going on with school. It's our last semester. Super excited. We got a lot of things coming up, but we got to do something very cool. I guess it was last week, and we got to go to the state capitol, and we got to watch the whole process of them proposing about basically the dental school and dental hygiene school doing simulated exams
bills,
for their
those
for their
bills
boards.
that were in the House and the Senate. Just happened to be there while we were there, so
Yeah, it was our Capitol Day, and that was really cool that we got to see it. We got to see it live being presented to the committee, and then we also basically got a shout out on the Senate floor, and we watched it be passed on the Senate floor.
Yes.
And I guess this past week or this upcoming week, it'll be passed through the House and then through the governor, and then effective immediately right after that, it'll be set in stone that it'll
Fingers
be
crossed.
from now on. I think it's indefinitely at this point.
I think so.
That mannequins will be part of dental, dentists' final exam and also dental hygiene.
Yeah,
So,
I was hoping for that one. I know we mentioned that in the last couple before,
I know, but that goes to show you
funny.
the kind of like the journey of what we've been, doing and what we've been going through, because you were super excited for that. And I actually got it live on video. I posted it on our story, and that was pretty cool to kind of like, it was like a relief moment for everyone. Everyone's like, yes, like everyone wanted to scream, even though you have to like, be quiet and be respectful while you're in there. So that was really interesting for us to kind of watch, actually go through and see it, because, unless you're literally following the bill online, other than word of mouth, you really don't know what's going on till that final step is done and it's set in stone,
Yeah.
So that was kind of cool that we actually got to go see it, go, watch the process. And that's through anything too, which is kind of cool as well. Anything that's being proposed. And I know one of the other bills that they want to, that was proposed to the committee that I guess got shut down this year, that will be presented next year, is basically the access to care.
Correct. Yep.
So it's basically to kind of, I know the gist of it is definitely to be compensated for providing, what we do basically outside of a dental practice, and be able to provide, basically access to a lot of people who aren't having access to care. And that's the idea
And bringing
of it.
in the Medicaid side of things too, trying to, what's the wording for that? Just get more people to accept.
Yeah, well, just to be
Medicaid?
compensated, because, there's a lot of that we can do, but it has to be volunteer work unless it's, being, done underneath a dentist directly in a dentist's office. So also the supervision plays a role in that.
That was it. Yep. You're right. That was the other thing.
So
The supervision.
that's kind of, pretty cool that I definitely hope that will be passed next year, or at least get past the committee and have that, argument, because there's a lot that would benefit from that. So,
And it's just a lot of unknown. So just going there, like we said, doing these Capitol days and kind of putting some light on what's out there, because a lot of these people don't know. It's not that they're against it or anything, they just don't know about it yet. So going to these days is really important, and just kind of pushing and putting that word out there. And
yeah, definitely.
that's where you got to start.
Well, I think that's also really good from like, our perspective of being a clinician, and also raises job opportunities for people who want to, realistically, you can, I don't know if you can, have like your own, like, I guess practice per se, but like you can kind of correlate your own. It's just a bigger, opportunity for job employment for us as hygienists, or maybe pick up, that could be something that could be done on the weekends kind of thing too. So I think that's a really good thing from, obviously we want to provide more access to care, but be compensated and, for that. So I think that's a really good scope of it, but it is kind of weird too, because think about it, like you're going to be doing it or traveling to kind of do things like that, and going into certain cities, and I think that's a little bit of the gist of it too, is being able to like kind of like travel and stuff too, with those certain programs, or people that are funding those kind of like businesses or dentists that are being able to kind of like have like a mobile dental kind of thing. And I know that's common in certain states and places. There's like mobile dental vans and stuff like that. So, and I think that really is kind of cool because you're getting outside your operatory. So it's like, you're really testing your skills in a way, like, cause you're like, okay, well, I can't take this with me, or I don't have I don't have a abundance of this. So
exactly.
It's just
kind of limited on what you have when you're,
you're limited, and you definitely got to be strategic, because you're providing care to, people that really need it too. So it's like, you got to be cautious of what you're, doing too. So I just think it's really cool with the whole kind of like from our standpoint, like actually that once it passed, I think it'll be cool and it'll open up a lot more doors than we don't really expect or know.
I agree.
But yeah, so I want to talk to you a little bit about like what's going on with like, clinic, as far as we're basically at the home little stretch of us seeing patients, which we had to see, a certain amount of patients, which was this semester, since it was our last semester, was the biggest number of patients.
Yep.
And, at this point, it's really kind of running through, the cycle of an appointment, doing it a certain time frame and, really testing your skill set. So,
kind of honing in on what you've been struggling with and kind of fine tuning everything, getting ready to go out there into the real world.
Yeah. And also applying the local, anesthetic part to it. So, I really want to open up to you and kind of let you kind of give, your experience, because you've actually, I think it was like one of our first days back, you're doing local on a couple of patients. And I think that's really cool. I mean, from what I've noticed, you and maybe one or two other people have really done it multiple times. I still haven't even had their opportunity yet with my patients, just because I haven't had a patient that need it yet. So, really talk about your experience. Like, I guess your whole mindset, your nervousness, were you shaking? Was your leg shaking? Like, what was going on?
It was, I think, only the second week back in. So I'd only seen a patient or two after the break, and that patient, I started going in and probing, and she was super sensitive, and she was like, "Oh, I've had local before. Let's do it." And our doctor there at the school kind of was pushing me. She's like, "You got it. You can do it." And I was, like you said, I was so nervous for it. Everything, like, as soon as I found out, okay, it's time to go, just started getting the nerves. I was kind of pacing around, slowly getting all the supplies ready, just to kind of mentally prepare. Like,
you're in your head, like, this? Okay, like, this is what I got to do.
But it was nice that it was also like kind of spur of the moment. Like, hey, you're gonna give local right now, because you didn't have time to worry about it.
Yeah.
I only had 5 minutes to think about what I was doing before I was actually giving it. But the dentist was great helping me, and she kind of oversaw what I was doing the whole time and kind of helped me, like, okay, this is where I'm going to go with it.
Yeah.
And the injections I gave IA and mental. And I know IA, just when we were doing it on each other, that's the one that I was most worried to give.
Yeah, of course, because that has the biggest room for error there.
Correct. Yes.
As far as, just what can happen from that, or, if you're not doing it properly, like, that has the biggest effect on, somebody, like that side effects. Can, cause facial paralysis, which
done
is
incorrectly. Yeah. So it was a big jump going for that first one, but after that I felt great. And then that patient gets dismissed and comes into the afternoon appointment, and I end up giving an infiltration. Yeah. I was like, oh man, I'm doing another one today. So having those two out of the way, I felt really good about that, because local, I was super nervous to give. And after hearing just from other people and experiences, like how much we might be actually doing it in a real office, it's good that we get this experience now and get as much of it as you can.
Yeah.
So I was glad that I got those two. And I resaw that first patient again the other day and gave local once again to her, same one, but on the other quad. And I'm feeling pretty good about it, but I just want to go and I haven't done any of the maxillary injections, so I'm ready to give those.
But I
hope I get a couple of patients for that. Yeah. But like you said, the ice is broken there. And definitely got that first kind of nerves out of the way. I'm feeling a little bit better with the needle now. Still a little shaky, but it's going to come with time,
and practice. Yeah. It's just the more you do it, the better. And I remember you were like, oh, I don't think I'm going to do it for this. I'm like, dude, just go for it. Like, you just got to go for it, because it's the anticipation that works you up way beyond your belief, where when you're like, finally like, okay, yeah, I'm good. Like, you broke that anticipation. You're like, okay, like, I've had 3 days to prepare. I'm good at this point. Like, it's going to work you up. And when it starts to happen, or when it starts to formulate, so I think just being able to do it is it's the way to do it.
Yeah. And it's one of those things you can only prepare so much for it. Like,
Yeah.
In your head, it's like, oh, I go 3/4 of the needle. I inject 1 to 2 minutes. Like, you know all the details, but honestly, when you're in there,
Kind of black out, right?
that's kind of the last thing you're thinking of. Yeah.
Definitely.
So you can only prepare so much, and you just kind of, some things you just kind of got to go for.
Yeah. Because like you said, the book definitions, but at that time and moment, are you like, okay, 2 minutes, a fourth of a needle, a fourth of a needle at 20 seconds, pull out the clock. Like like you know what I mean? Like you're obviously looking at a time where, there's different things that you're definitely applying it, but it's like you said, just go through the motion. And if you make a, small mistake, then you'll adjust from there. But that's why, we do it in school, like you said, because when we get out there, doctors are going to look at us like, okay, like, I'm not going to sit here and watch you every single time you have to do it. We're expecting it at this point, you know? So just got to do it while you're in school and take advantage of it.
Definitely.
And it was so funny because my first day back, I was like so ready. I was like, okay, I don't care. Like if there's a patient that's somewhat sensitive, if they're a little bit uncomfortable, I'm like, I'm going to go for it. Cause I just wanted to break the ice. I just really wanted to kind of get that out the system because like I said about the anticipation, it's like, get it out,
I know once you sit on it for a bit, then it starts to become like, oh man.
But talk about like after you like actually administered it, like how was the patient? How was like actually cleaning their teeth? Like
it all went really good. I mean, she got numb right away. Didn't have to give any second injections. And I mean, it was pretty straightforward. And then the cleaning went great because like I said, she was very sensitive before. And after the injection, she was fine the whole procedure. And it just made what I was doing a lot easier. It benefited both of us. So it was much needed for her and I, and got the job done with that. So,
yeah. Well, I always like to ask about like cleaning because that's like my biggest thing. I'm like, I want it to be easier, not just necessarily like take your sensitivity because sometimes it's just, pain and discomfort where it's like, okay, we're going to have to numb because we can't, do what we need to do. And this is really, hurting you long term because you're moving around or that thing. And sometimes it's even nervousness that is like, it's a contributing factor. It's multiple things that are playing, a role in what's going on. So it's like, okay, like I need you to kind of hold still. And even with the numbing. So that's good that your patient was really good about, like going through it because that's the other thing too, is like learning on like a patient who's very antsy or something like that. That kind of plays a big factor of it. You want to kind of, I guess, make sure that the patient isn't too nervous. I mean, everyone's going to be nervous. I mean, I was nervous. When you did it on me, I was nervous. Like, I didn't show it, but inside my head, I'm like, oh, man, like, just don't go all the way through my lip and we'll be good, But everyone will be nervous no matter what it is. You think of these things. You just kind of go through it. And people feed off of your body language and how you approach it, too. And, like, that's my biggest thing is like, I was saying, like, you kind of black out, a little bit. And I don't know if patients pick up on that because it's like, you want to talk them through it. And that's my biggest thing is talking the patients through it talks me through it. So it's like you said, it benefits both of us, so.
And that was a little hard for me to do. I was trying to do that because I know when we were watching the doctor give injections before, they're always kind of like, okay, breathe through your nose, wiggle your toes, move your fingers, trying to do inside things. But with this one, I was like, okay, I know I should be telling her to kind of like breathe through your nose and relax a little bit. But I was kind of so focused on what I was doing. It was a little more difficult. That's just like, because you're trying to multitask it, basically. If I was like, okay, breathe through your nose here, but I wasn't jiggling her lip when I was going in to insert or anything. It was just like, I'm focused on my spot.
That's okay.
I gotta go.
Like you said, practice. That's all.
It'll all come. But it was good.
And my other question is, did you use your loupes while you did it?
I did not use my loupes while I did it.
Okay. Just because I know you're still adjusting to them. And I didn't know if you just maybe had them on because I know you haven't whipped them out the first couple weeks. And
so at that point, I wasn't even wearing them yet.
Yeah, and I was pushing you. I'm like, dude, just use them. You got to get adjusted. Just use it. You're not going to feel comfortable when you have it on the first time. So I guess talk a little about your like loop situation, what your outlook of having them and what you find useful of them. And obviously this is different for everyone. So, it depends what company you use or, what magnification you use, whatever it is, like definitely like that plays a role. But talk about like, I guess your experience and what you're using on them and stuff like that.
So far the light has been the biggest help. Having the light on there and not having to worry about fiddling up with the light above your head and getting it straight on because it's wherever you're looking, your light is pointed right there. So the light has been the biggest thing I've enjoyed. But the Loupes, the magnification is 3.0, so it's pretty normal.
Yeah.
But just getting adjusted to it, just because you can't see everything like you can, because it focuses in on your
like what you're
field
looking
of
at.
view, on your field of view. Yeah.
Yeah, like it's like a tunnel vision,
Yeah,
basically.
so you're kind of only looking at 3 or 4 teeth versus the whole mouth, and that's what you're so used to doing. And that's for me where it's been like the biggest change is I'm used to seeing everything. Like I can see my patient when I'm in there and working, and just kind of like that tunnel vision, like you said, has been a little off, but I can see great with them on. You can see every millimeter on the probe. You can see certain calculus, but I don't know. I really don't know what it is that's turning me off about them.
Yeah.
But I think we said, just got to get used to them.
Yeah.
I know we were discussing the shield the other day, maybe having the proper shield to go with it or mask, because it was fogging up a little bit. I have some fog spray, so I do want to try that next time. Just like with anything, you kind of got to work through the kinks at first and get it dialed in before it's going to be a part of your daily routine. So like I said, I need to definitely just stick with them, work through all the little issues, and over time it'll be fine. I've only used them we only have clinic twice a week. Yeah. So I've only used them 3-4 times. So it's like, they're still very new.
Yeah.
Very new at this point.
Well, I think persistency and consistency with that is really going to be the contributing factor. And the same thing with the local thing. Like you got to be, feel comfortable with it. The more you do it, it's just going to happen. Same thing with the Loupes. And it's just like almost anything with what we do, Mm-hmm. We didn't like scaling with certain instruments. And then, later down the road, you feel like, okay, this instrument might actually work for this. And, it's just, you got to keep, at it. Yeah. And I think that's the biggest advice we have. I have for anybody who's going through this program or any dental program at that, whether it's assisting or dental program or dental hygiene, whatever it is just stay, consistent and persistent with it. Like,
yeah, it was definitely good that you kind of pushed me a little bit to like, hey, pull them out. Like, what are you waiting on?
Yeah.
I don't know what I was afraid of at first. Like, but I was hesitant on getting them out just because I told you I don't really like to, like, I finally got a routine. Yeah. And I was like, I don't want my routine to change
Break
now.
it. Yeah.
We're still in that window where your routine's going to change yet. Like, you're not in a constant routine yet. Yeah. As much as you want to be.
And I think that's even like with what we do. Obviously, cleanings are very repetitive, but the anatomy is different. And, it's always going to change. There's going to be so many things that are affecting, the day or the appointment process. There's going to be so many different things. And I think for me, with clinic, it's funny this past week, like, I guess that I finally found my routine with, really being efficient through an appointment sequence and starting off, and going through all of the documentation and the assessment and the exam. And I've always had the mindset to kind of, I wouldn't say rush things, but definitely go fast. And it's funny because like now I'm going through things so fast that I'm done within like an hour and a half to 2 hours, where we were starting and struggling at 4 hours, where I'm like, holy crap, I still have another 2 hours. Like, so like, honestly, I utilize it. Like once I get to that point where I didn't notice it was happening, until it happened. And then when it happened, I was like, okay, I'm going to use this time to like, maybe do a little bit more, education with the patient or something like that, once I'm done cleaning and everything, because once you get to that end part of the appointment, you're like, okay, like there's really nothing else you can do, So, if there's something that I'm like, okay, let me triple, quadruple, check, make sure that everything is gone, even though the instructors already came and checked and it was okay. I like to go back even after that, and just say, okay, let me check one more thing. I want to make sure this, or spend a little bit more time. If they had asked about something in the, during the appointment, or that when I was educating them, I said, let me spend a little bit more time doing that. So I've become efficient with that. And, like you said about the whole loop thing, that's kind of like my mindset. Why I told you, like, I really didn't want to incorporate the loop thing yet. And that's why I haven't gotten Loupes, and I really couldn't hound in on a specific brand either, because there's so many different brands out there of Loupes. And I think once I get everything and I feel comfortable, then I want to add that, and then that'll be my adjustment. So, but that's to each his own, that doesn't have to be, the right thing or the wrong thing, because you're going to be comfortable before I am, with them. So it's just how you want to work through it and do it, so.
And I know a big reason kind of why I was hoping to get used to them was for the boards. Like I was like, hey, I know all the examiners we were told have them. So I was like, well, this is only going to be like, it's only going to benefit me if I can get used to these and have them when I go to take my exam. So that was kind of what drove me to get them a little bit. And then, I mean, not going back on it now, I don't regret getting them.
No,
just
definitely not.
Back on
You're working through
I'm still
it.
going to use them later, but
yeah,
I don't know.
No, but that's why I asked about like the clinic and going through everything, because, the MANIKIN, it is a good like kind of like stress reliever, because we don't have to worry about, finding the patient, had them meeting a qualification, getting them there, paying for them. We don't have to worry about all that, which is great. And I'm super stoked that is the stress that we don't have to worry about at this point. But the other part of it is now it's like, you don't have that reassurance of going through everything you've been working on, like, because you're worried about that patient, that interaction and that kind of stuff. And, like I was telling you, I didn't really care or not care about the MANIKIN thing. Not that I even have a board patient. So I think that's a big thing too. It's not like I didn't want the MANIKIN because I didn't have a board patient. I still wouldn't have had a board patient till this day, So it's not that I just had somebody in mind and I was like, no, I'll be good, kind of thing. Like, it was not that at all. It was just that I was really focusing on like all of my things to make sure that I was good for, the exam in clinic. And like I said, even the time thing, and it was good because we even had the mock, basically boards clinical last semester. So that really kind of like, okay, I got to work on this, a little bit to get better on timing or whatever it is. So I just wanted to kind of see how everything was playing in, because now, like you said, we're hounding in on.
Yeah, it's all coming together finally.
It's all going together. And I guess I do want to ask one more thing about clinic is, how are you feeling about like x-rays and radiographs? Because I feel like everyone really always has that like kind of in the back of the head, like, when am I going to get comfortable? Like, do you feel comfortable taking radiographs yet?
I enjoyed radiology when we were in it. So I'm now at the point where I think I'm pretty comfortable with taking them. Like, it goes along with everything else. Every patient's a little different. Some of them have a little more challenges than others, like due to tori and that kind of thing, or reflexes or whatever. So that part of it is always a challenge. You always have to adjust, but I'm actually feeling pretty good on x-rays. I think this semester so far, I haven't taken any full mouth series yet. I've only done bite wings and pans, but I know at first I hadn't done any pans. So I mean, pans are pretty easy, but
yeah,
I feel comfortable in the pans. I feel comfortable in bite wings. I want to do a little more of the like anteriors and PAs and that kind of thing, but I feel pretty good with them in placement. I don't know if my speed is there yet, but I feel good.
That'll come in time,
location and angulation. I'm feeling good on all that now. So
yeah,
that part of it, or everything we're doing, I actually like.
Good. Well, it's good that you're feeling comfortable, because that is like, whenever, I would, teach my students about like doing that kind of stuff, is you just got to focus on one thing. And that is realistically like what I say about our appointments and everything like that. And even with like your loupes, like, you got to focus on one thing. Okay. Like, for example, with your loupes, you were saying how it was fogging. Focus on the fogging, get that dialed in. Same thing with the radiographs. Okay. Every time I take this PA, I'm shoving it in the back of their mouth and they're gagging. Okay, so how can you adjust for that? Focus on that one thing so that next time you won't do it, because it's a lot of, multi-factors, happening all at once. And you're like, okay, and you're thinking about this and you're putting the RIN backwards, and then you're talking to the patient, and, there's so many things going on. It's just focusing on that one thing, and then you'll just get better at it.
So
everything will come better
one
at time.
step at a time is what you're saying.
We'll just dial in on one thing.
Yeah.
Because there's, especially with the radiographs, there's so many things going on. Nobody can take a perfect FMX every single time. Like you said, every mouth is different. It's never going to happen.
Yeah.
It's
very easy to get overwhelmed with the stuff that we do.
And the timing.
You got to be patient.
Like even how I was saying about like how I'm going through appointments, or the, our whole appointment sequence faster. And it was because I was focusing on really like pushing myself time-wise to get that down, because like for me, that was like a big thing for me. I was like, I'm not going to be able to feel comfortable going into an office and saying, let me clean 8 patients a day. And I'm like, I can't even clean 2 in a day, you know? So like that was like kind of like my focus. That's what I focused on, you know, and I really work through things, you know, the way that I know that it takes me longer to probe. I don't take that long to probe, you know, or whatever it is. So same thing with the radiographs, like just focus on that one thing and you'll get better at it with time, you know, like it took me a long time to really get my time down. Like I can comfortably say this, like I will gladly publicly say I can take an FMX in under 5 minutes.
Yeah.
Gladly.
No, I
But
agree with that too.
It takes a long time. It's just, you know, practice and, you know, working with, you know, and that doesn't mean that I can take that on a patient who gags on everything. Like that's not going to happen in 5 minutes, you know, but I can say on a, you know, pretty basic dentition that I can take an FMX in about 5 minutes, you know, that should never influence others and discourage others, because just like I did it, it did not start that way.
Correct.
It started with 45 minutes. It took me like a good like year to like really get comfortable with taking it under 30 minutes or 20 minutes, you know, and then you just work through it, you know? So
I remember when I saw you take your first couple, you would go into the x-ray room and you'd come out 10 minutes later and I was like, "You're done?" You're like, yeah, I'm good. We're completed already. We're kind of like, what? How did you get it done that fast? But like I said, just that experience you had there and didn't start off right out the gates like that. It took
just
you a little
practice.
bit. Yep.
Just practice. That's all it is. And I guess really just kind of wrap up a lot of these things, because we touched on everything that we've been doing, and you know, kind of want to give some future stuff going forward. So we do have some guests that are coming on episodes soon. We do have some doctors that are coming on, which is pretty exciting. So any of our hygienists or, you know, future hygienists or assistants, if you guys are looking to get some doctor insight, or any of the doctors that I listen to it'd be cool to kind of hear, you know, different doctors from different specialties or whatever it may be. So that's really exciting. So guys, stay tuned for that. And we're also looking for guests. So if you guys are listening to the podcast and you're like, I'd really like to go on, you know, on the episode and kind of talk with you guys, chat with you guys about whatever it is, you know, we'd love to have you on. You know, just feel free to reach out to us on social media, on Instagram. You can send us a message, or you can send us an email at becauseteeth at gmail.com, and just send us an email, say, hey, you know, we want to come on the episode and, you know, talk about, you know, maybe it's a product or what you got going on, or just you're in school and you want to like get your, you know, our advice on something, whatever it is. Like we love to, you know, create content and, you know, kind of interact with you guys. So we are working on some interaction kind of things with you guys as well. You know, we always do, you know, different giveaways, and we tailored, you know, certain ones to do certain things. So we're going to continue to kind of keep interacting with you guys, and we appreciate anybody who listens to the podcast. And, I guess just wrap this episode up with what we've been working on is our website, and that's been pretty hard to get all situated. That's been a lot. So
yeah, I never realized how much went into a website, but it'll be pretty rewarding once we have it up and running. Like feel that sense of accomplishment for sure, getting it up.
Yeah, all the coding. I mean, Cody's a coder. Cody's a coder. So,
right, that marketing degree is not going to complete waste. So
see,
I knew it wouldn't, but it's funny. All coming back around, we started doing this stuff. I'm like, oh man, this is the stuff I learned back in the day. So it's all coming full circle. Yeah,
we've been putting in work on the website. Yes. So we have some apparel that'll be on there. We'll have some hoodies. We'll have some sweaters, and we're gonna get some t-shirts on there as well. And when we have this website basically launched, there's going to be a lot more on there than just, you know, go on there and buy stuff. It's going to showcase, you know, me and Cody's, you know, what we've been doing, what we want to do, and kind of things as well. And it also gives another form of you guys, another form for people to reach out to us. So that'll be a part of it. And you know, really that's it on the website. I mean, I don't want to give too much out there. So if you guys are supporters and listening to our podcast and our episodes, make sure you go check out our website as soon as it gets done. We're shooting for beginning of March. Maybe, you know, hopefully if not March 1st, you know, right after that.
Yeah.
But we're shooting the beginning of March. We don't have a set date in mind yet, just because we're still working on a couple of things, but that's our goal. And any of you guys that want to support us, go on the website, purchase some merch, and that'll be your way of supporting us so we can kind of get some other things going too. Mm-hmm. So other than that, let's go into dental terms. Let's wrap up this episode.
Dental Terms 102. All right. So my word of the day today is syneresis.
So syneresis is basically the reaction of when the water meets it's something with the reaction. That's all I remember.
It has to do with water with an impression.
Yeah, it's like the compressive nothing. I don't know.
There's syneresis and imbibition.
Inhibition. Oh.
Imbibition is the other one. Yeah.
Yes.
So one's water going out and one's water like coming in, like absorbing. The other one's like expelling the water. Do you remember which is which though? The syneresis or imbibition?
Syneresis is probably going out.
Yes, syneresis is it going out.
Yeah, inhibition just because
Imbibition, yep, it's absorbing that water from the that impression material is absorbing the water. So I always think syneresis, I think sucking, like it's sucking the water out. Just the two S's there kind of help for me. That's kind of how I get those two straight. But that was a word that I know one of our instructors told us, hey, this is going to be on boards. It's on there every year. So
yeah,
it's a word to stay on top of. Syneresis and imbibition.
I just remember the reactions. I know it's bad, but I just don't remember the specifics. And if it's applied in a question, then I'll dissect it.
Figure it out,
like if you told me what's the water, reacting with what. And I guess give an example too, because I don't want to say the wrong thing, but give an example of what.
Well, so of how it's applied.
Yeah, like would it be like with the water with the alginate, and that's the reaction that's coming?
Yeah. So say you take an impression and you leave it on the counter, and you know how we wrap that paper towel around it to kind of keep that water from leaving the impression, from shrinking it. So if you were to leave it on the counter for a month and a half, and that paper towel dries up, the water in the impression starts to come out of it because it's drying up. So the water is leaving the impression material. That would be syneresis there. So the water is leaving it, it's drying up. That impression is now getting shrunk down. It's basically shrinking like a sponge. You could think of it as like it's losing its water, it's shrinking down. That's why after so long, they're not really accurate anymore. The size isn't correct because all that water, it's not the same shape that it used to be. It's shrunk down. So that's syneresis.
So imbibition, I can never say
Imbibition.
that. Imbibition because it's IM.
Yes.
Imbibition is hydrating, and then syneresis is dried out.
Yes, imbibition is the absorption. Yep.
There you go.
And syneresis, sucking it out.
There you go. All right. Well,
That's what we got.
that wraps up this episode. If you guys have anything for us, like I said earlier in the episode, reach out to us on our email at becauseteeth@gmail.com. And follow us on social media. If you're not on Instagram, we're just at becauseteeth. And other than that, continue to keep listening to us. We got some really exciting stuff in the future, and we'll see you on the next episode.
Why do we do it?
Because teeth.